Hi, this is Dr. Jonas Lee Woods. I'm a practicing endocrinologist for nearly 30 years, and I'll be talking about type 2 diabetes today on behalf of my diabetes doc. So today, briefly, we'll just discuss how do we make a diagnosis of diabetes. And I think type 2 diabetes is always going to be the focus of what we talk about for the time being because so many people have it. But we diagnose diabetes based on a number. So sometimes you'll hear people say, I may have diabetes, I could have, I have mild, I have severe. Let's just get the diagnosis down straight. So it's based on a number. A fasting sugar of 126 milligrams per deciliter or higher is diabetes. That is diabetes, okay? And that's something that you can do after an 8-hour fast if you come into your healthcare office and take a physical or just get blood test done. You would use that diagnosis. We usually like to do two tests, a confirmatory test, maybe 2 separate times, or other tests as well. A random sugar or glucose of 200 milligrams per deciliter or greater at any time, so really randomly, but associated with symptoms of high sugar, like extra urination or extra thirst, blurry vision, things like that. That would be consistent with the diagnosis of diabetes. And probably the most important test and the most consistent test called the hemoglobin A1C. And that's a very nice test. The hemoglobin A1C tells us the average sugar. So you can come into an office visit fasting for 3 days. You can come into an office visit and perhaps you've eaten very, very high sugar foods for many, many hours. But a hemoglobin A1C cannot be fooled. Hemoglobin is your blood cells, the guys that carry oxygen around your body to help you perform the activities that you need to perform. And hemoglobin in our body lives for several months, 3 to 4 months or so. Sugar will stick to hemoglobin. So the hemoglobin A1C is the amount of sugar that's stuck to hemoglobin in a percentage. And our definition of diabetes is 6.5% or higher. So if you have that percentage of sugar stuck to your hemoglobin, you meet the criteria for diabetes. And that can be done any time of the day or the night, fasting or non-fasting, and it's pretty easy to do. There are also some other tests that do hemoglobin A1C that could be by finger stick or some rapid machines in doctors' offices. So there are many ways one can do a hemoglobin A1C, but it should be standardized, and the labs in most of our countries will tend to run a standardized test. So that's how we diagnose diabetes. And all diabetes types are diagnosed that way, and we can review diabetes types in the future, but that would be the definition of diabetes. One caveat for pregnant person, usually a glucose tolerance test is used, where a certain amount of sugar syrupy kind of drink is drunk, and then the sugar levels are checked at different intervals of time, and there's its own diagnostic criteria. So that's used specifically for that population. The glucose tolerance test was more popular back in the old days, I think when the hemoglobin A1C wasn't as standardized, and that test was done where you would drink the same type of drink and then measure the sugar several hours later, and we had that criteria of 200 or higher back then. If you're confused about the test, maybe the A1C and the fasting sugar don't kind of match or they're not in sync with each other, there could be a role for the glucose tolerance test. But again, with the development of rapid lab testing techniques and hemoglobin A1Cs, it's not used very often in clinical practice.